Go ahead.
Welcome, everyone. Thanks again for joining us for our once a month call to get updates on our response to the global pandemic and how we're responding as a county, specifically through our human services sector. I want to take a moment to say thank you to the Westmoreland Museum of American Art, who provided our artwork for us today. This artwork is called Apples in a Brown Hat, and it shows artist Levi Wells' Prentice's favorite fruit, which he painted in a variety of ways on tabletops and under a tree and growing in its natural habitat. His apples are not glorified, beautiful, or perfect, but instead they appear as if they would in nature, complete with bruises and gouges and bumps. Prentice paid meticulous attention to detail, and this obsession, as well as his thorough arrangement of the elements in his still life, carried over to his careful study of natural landscapes. The vibrant colors, hard-edged forms, and sharply focused details in this painting are symbolic components that together form Prentice's trademark style, and with his landscapes, lend his work a curious, primitive, yet contemporary air. So once again, thank you to the Westmoreland Museum of American Art for providing that for us today. We'll go ahead and jump right into the rest of our agenda now. We have a great lineup for today. We have, of course, Dirk Mattson with us, as well as a representative from the United Way. Alyssa couldn't be with us today, but we do have Jesse Spragar, who's with us. We also have Dr. Fox from Excel Health and Bud Mertz. Dr. Conway's here, as well as Jennifer Miller from the Westmoreland County Food Bank. Sherry Anderson will be here to share information from Feeding the Spirit. Dan Carney from Union Mission, as well as Jordan Polito from the Hill Group, who is working on our human services study in partnership with the United Way and the Westmoreland County Community Foundation. And finally, we'll hear from Jim Smith on our CARES Act funding for the county. So I'm just going to jump right into it by passing it over to Dirk. Dirk, do you have anything that you want to update us on today from the county standpoint, behavioral health and developmental services?
Yeah, I do. I just wanted to let everybody know we're in the process of updating the spreadsheet on human service and in particular mental health data points, just to try to keep a read on what's going on out there. So if you haven't sent your updated information, your updated data, please do so. Tony will be in touch with you if she hasn't already, Tony from my office. So please be sure to get it in so we can keep getting a read on what's happening in human services. Some of the same indicators are, at the last time we had it updated, are still pretty much the same. Crisis calls are up. MA enrollment has steadily climbed, which is probably a function of unemployment more than anything else, but could also be an indicator of crisis, mental health crisis, drug and alcohol crisis as well. One other thing I wanted to mention to everybody is that Lori Barnett-Levine from Mental Health America and I are beginning legislative visits. Our first one is next week with Eric Nelson, but we're also going to be in contact with Mike Reese, Kim Ward, Joe Petracca, George Dunbar, and possibly some other legislators to find out what's going on with the budget and what we can expect this year, and to advocate to hold the line on human service cuts, not to make those. Of course, as everybody knows, this is going to be a particularly tough budget year, and the legislators postpone making any decisions until I believe is at the end of October when this budget is up. Phil's shaking his head yes. So I would advocate that everybody else out there do the same thing for human services. It's we've got to make our voice heard out there. Otherwise, who knows what's going to happen? So this has got to be an all hands on deck year for everybody to speak to their legislators about human services dollars. And Phil, that's all I got. Thank you.
Great. Thanks so much, Dirk. I appreciate it. I would echo your sentiment about making sure our voices are heard and connecting with our legislators. Just a reminder that I know that there's a little bit of a misconception that because we work in the nonprofit sector, that we can't do advocating or policy work, and that's simply not the case. There is a limit on the number of hours that you can dedicate to advocating for specific legislation that's been called to the floor. That's different than talking to a legislator about a budget line item, or the way in which we want to see our sector funded. You can certainly do that without being infringing on the IRS laws. I just want to underscore that.
I also, too, Phil, I just wanted to also mention that if anybody wants to join us, we sent out a call to a number of people that are possibly going to join us on Zoom calls. If you're interested in being part of those discussions, they're not going to be in person, they're going to be by Zoom. Please contact either Lori or myself, and we'll try to get you connected. Also, great. Phil, I wanted to mention, I just got Sherry's cell phone number, so I'm going to mute in a second and give her a call.
Okay, got it. Great, sounds good. And Dirk, count me in for those legislative visits, all right?
Okay, good, Phil. Excellent.
Sounds good. Thank you. I'm going to go ahead and
I see Sherry's online. I see her microphone is open.
Great. I'm going to go ahead and move on over to Jesse now from the United Way. Jesse, thanks for joining us in place of Alyssa, who I believe is taking a much-needed vacation.
Yeah, yes, she is, and thanks for having me. And Dirk and Phil, your points are well taken on we need to keep human services at the front of the line when it comes to the budget talks. Alyssa just asked me to share real quick on 211. We are seeing kind of a slow decline over the months of 211 calls, almost solely tied to food calls are going down. And I don't say that as the need's not out there. I just think it's directly related to the great work that Jennifer and her team and Deb at Feeding the Spirit and all our other human service agencies that are giving out emergency food boxes. People know where to go now. And the pantry network is really working well. So that's pretty much directly related to the decline in calls. We are still seeing more than double the calls that we were at this time last year, with right around 75% of those being for rent assistance and utilities directly. So, you know, as we move into the fall months, we don't expect that to decline. So the need is still very, very high. And I can't stress that enough. And you know, that's pretty much where we're at. Everything that's coming in is utilities and rent assistance, and we don't expect that to fall. So we're keeping at it. We are hiring for 211. That's where the call volume's been, how high it's been for the last 6 months. So yeah, it's not falling quick enough, that's for sure. So the need is still very, very high. That's all I got this morning.
Thanks, Jesse. Appreciate it.
Thank you.
From the Communities Foundation standpoint, I wanted to talk a little bit about a grant opportunity that we have coming up. That has been where we've launched the RFP. There's the slide for you. So just wanted to announce that we have 2 information sessions coming up for this line of funding. This is for our Healthy Communities grants. Those grants are really geared towards the folks that are on the call today, those that are in our human services sector. And these are grants to support the most vulnerable populations in our community, particularly those folks that are living in poverty, families that are struggling with, upward mobility, families that are struggling with food and housing insecurity, mental health issues, including addiction, supports for those that are exiting incarceration, and special focus on families with single women raising children in their household. So I did invite you to join us on this Friday, tomorrow at 10:30, or on Tuesday, September 15th at 1 o'clock. If you go to our website, the Community Foundation's website, and search under the Healthy Communities tab, which is under our grants, then you can certainly register for those RFP sessions. It'll be a Zoom call where I'll be explaining a little bit more about that grant opportunity. I do want to highlight that one of the changes that we've made to those grants is that we want to support our nonprofit organizations in their unrestricted funds that they have available for themselves. Any grant that we will be distributing for any project or program, we're going to add 20% of that budget on for as an unrestricted grant for you to use for whatever you need to use that for to keep your organization going. So I'll explain a little bit more about that on the RFP call that will happen tomorrow morning or on Tuesday. So I hope you'll join us for that. That's all from the Community Foundation's standpoint. So we're going to go ahead and move on over to Dr. Fox, who's with us from Excella Health. Dr. Fox, really appreciate you being with us. Love to hear how things are going over there.
Good morning, everyone. I hope you can hear me okay.
Loud and clear.
Okay.
Thank you.
Great. So currently at Excella, we have 6 COVID positive patients in our 3 hospitals. We have no COVID patients using ventilators. We have 71 available ventilators. So our capacity to handle sick patients is strong. Looking at our overall positivity rate since we started keeping track back in March, we're at 3.6%. In the month of August and September to date, though, we're only at 3.1%. So we are seeing a little bit of a downturn. However, we're holding our breath a little bit as we look at, going more deeply into the fall with individuals in school, with more individuals being indoors. We have diagnosed almost 600 patients in total. We have not had any mortalities at Excella since the 22nd of August, so that's good. Our PPE supplies are very stable. Our Fry Farm Road site remains open, and it will remain so through, at the minimum, the first quarter of 2021. We have seen over 10,000 individuals there thus far, 2,000 of which have been evaluated by a physician. As we move into the fall, we are hoping to expand our capabilities there. We're adding phlebotomy, we're adding EKGs, so that individuals who have influenza-like illnesses can be seen there. We can sort of segregate that population outside of our clinics and outside of our hospitals. We will be using telemedicine as a triage point for individuals who may need to be seen at the clinic so that we can get people who are potentially COVID patients seen at Fry Farm Road and others who are appropriate, get them to their primary care physicians. But we are, even with our primary care physicians in general, our goal is to expand telemedicine. We do have that capability in each of our offices, and we used it very effectively in the height of the pandemic in April and the beginning of May. That sort of tailed off as individuals have felt more comfortable and wanted to see their physician in person. And we're very glad about that, and we're happy to provide that service. But we know that there may be an opportunity or a need to ramp up telemedicine. So we are working on that. So we would encourage, individuals to take advantage of that option, particularly if the situation in the county does change. We are participating in a regional collaborative. We're working with Allegheny Health Network and UPMC to work with our skilled nursing facilities and personal care homes in our region. And we are helping them to coordinate their universal testing that's now a requirement for them. We're performing risk assessments in their facilities to assess their ability to handle surges. And we're also working with them in the event of what's called a rapid response, which is when they have an outbreak of either an employee or residents of those facilities. And when we do those rapid responses, we're providing infection control assistance, helping them identify their zones for placing patients and helping them with their PPE needs. So we are in approximately 60 facilities in our county, and we're very happy to be participating with our partners in that regard. And I guess the last thing that I would say today is just to remind everyone that it is getting to be flu season, and it's time for individuals to get their flu vaccines. We know that, flu is common at this time of year. When we look at countries whose flu seasons are a little earlier than ours based on climate, happily, we are seeing lesser volume of influenza as well as less severity, which we believe is related to widespread masking. So we're hoping that we get that same effect here, but we do not want to take our foot off the gas in terms of individuals receiving influenza vaccines, because we know that there's going to be 2 illnesses that are prevalent this fall, influenza and COVID-19, and anything that we can do to mitigate either one of those, we'd like to do. So please keep wearing your masks and get your flu shots. And that's it for me.
Great reminders. Thank you, Dr. Fox. Again, really appreciate you joining us this morning and every month that you've joined us. Really appreciate that. Moving on over to Bud Mertz with Public Safety. Bud, I know you've been real busy. Love to get an update.
Yeah, it has been busy, but fortunately, it's hasn't been that extreme on the COVID side. We continue our operations, our tactics under our incident command system, covering our COVID response. But our main goal, based on the tactics that we have set up, besides the support that we have for the locals, but our main goal seems to be just to be able to monitor the current spread and the current situation so that we have an idea if there is a surge, that we can properly handle it and get the right pieces in place with our EMS services and coordination with our hospital. So Excella Health and the report that Dr. Fox gives each month that is just awesome, and they've been great partners with us in helping us do that, monitoring any type of a surge. I get daily reports from them as far as their patients under investigation and their ventilators, and that's important for us to share to the local emergency medical service directors, the ambulance directors. That along with our 911 calls that we keep, monitoring and making sure that we have that count as well going out to them. And the whole idea, again, is to be able to be that one step ahead of that surge so that everything's in place. So we continue to do that, and all the other pieces that fit into place that actually supports that same mission. We still are doing our PPE distribution, and we still have masks for the nonprofits available, the cloth masks that are available. So going into this, and a good report too by Dr. Fox about how the masks may slow down the spread and lessen the severity of the spread for on the flu. So I encourage everybody, if they haven't taken the opportunity through the foundation and that offer, we have those available as well. But it's been crazy for us in between presidential visits and working with the safety and security committees of the different candidates that are coming in, as well as the other stuff that's on our plate. I just want to remind everybody that September is National Preparedness Month. So this is annually, we take the month of September and we go out and we tell people how they need to be prepared for disasters. Now we're doing it in the middle of a disaster, but I can't stress the importance of being prepared. And I just want to make sure that we have literature available if anybody wants to push it out. It's hurricane season. Do we get hurricanes in Pennsylvania? Yes, we do. I can tell you that exactly in 2011, we had the remnants of Tropical Storm Lee actually wipe out the center of Pennsylvania, the Susquehanna Valley of Pennsylvania, from the New York line to the Maryland line. And we woke up that morning with 1,100 families without a home to go to. So preparedness is very important. I just want to push it. We have literature that we can push out to make sure that people build home plans and practice home plans, and it makes an effort to be prepared for what could be worse. That's all I have. Thank you.
Thanks, Bud. Really appreciate it. At this point, let's go ahead and pivot on over to the other person who's probably the busiest in our county right now, Jason Conway over at the IU with back to school information. Give it to us.
All right. Well, thank you very much, Phil, and thanks for the opportunity to address the group today. So we have had successful openings of school all throughout the county. all 17 school districts, the 3 CTCs, our charter school, and the numerous non-public schools, relatively without a hitch. As a county, we are identified as moderate in the education world, which means that it's recommended that districts are offering a hybrid model or fully virtual. Most of our school districts are offering a hybrid type of system where parents do have choices of either sending students in part-time physically or participating fully remote. So things seem to be going very well. We have had a few instances where we've contacted the Department of Health, as well as what they've created now is a rapid response center for educators. And the state has been very responsive to all of the questions and advice and guidance that's been asked for. So good news on that. At the ground level, it appears that faculty and staff are cooperating very well with the masking requirements and the physical distancing that students and staff are asked to do. So I think people realize the importance. If we want to stay in school, we've got to make sure that we follow the recommendations of masking and physically distancing from each other. Last but not least, I think we're all dealing with this, is that the technology supplies continue to be drier than we had hoped. And so we do know that there are some that are still waiting on things that they ordered back in the summertime. And that's just going to be a slow process of regenerating those technology supply lines, for Google Chromebooks, laptops, cameras, microphones, and things like that. But all in all things are going very well. I'm happy to report that for this group.
Awesome. I appreciate your leadership. Thank you, Dr. Conway. Moving on over to Jennifer Miller with the Westmoreland County Food Bank. Love to get an update.
Hi, everyone. Things are going well here at the food bank, thank goodness. It's been a long year, as it is for everybody else. Our numbers have evened out, just like Jesse said. We're not seeing as many emergency calls as we were, thank goodness. Our high point again was in April. Needless to say, we reached about 9,000 families. We're down to about our normal 7,000 to 7,500 families. We think that a lot of it has to do with there are so many organizations that are providing food to people that are in need right now. So we may not be seeing people who are going to stay on the rolls. However, the new people that we are seeing are citing the fact that it is due to COVID-19 job loss or whatever constraints, I should say, are facing their families right now. It is Hunger Action Month. You see me with my orange on today. Today is Wear Orange Day in honor or in commemoration of Hunger Action Month. So we'll be doing a big staff and volunteer picture here this morning. So it feels like the whole year has been Hunger Action Month, been that busy, but we haven't been able to do the things that we normally would do, like our partnership luncheon and some of the other face-to-face type of events. So, but we're doing the best we can to get the word out through social media about Hunger Action Month. We are planning to do pre-boxing through the end of the year. We feel that that's in all of everybody's best interest, with not knowing what the fall is going to bring in terms of numbers. We felt that would be best. We did survey all of our pantry sites to find out if they felt the need to continue on after December. Most of them are saying yes, they would like to continue to do the pre-boxing. Some said that they would like to do the pre-boxing but could go back to the old way, and some said there's absolutely no way that they could do it without having it pre-boxed. So we're facing some tough decisions here in the next quarter, but again, we'll be working with pre-boxing through the end of December at this point. Through our SNAP application assistance program, 78 applications since March have cited the fact that they are applying due to COVID-19 issues. Regular boxes, we've given out over 25,000 regular boxes, and that's duplicated individuals. And volunteers, which is something that really shocks me, we've seen, now these are duplicated numbers as well, over 36,000 volunteers. That is at our pantry sites. That's mostly in our warehouse that are coming to help doing the pre-boxing. And we're in need of volunteers right now because most of them are going either back to school or back to work, which is great. But that leaves us in a little bit of a pinch. So if you have anybody that can come and volunteer during the day, we have all of our open slots are on our website. So please, if you know of anybody that's willing to come and sign up to volunteer, we could use the hands. A lot of our staff are going out during the day when they have other things to be doing and to pack those boxes, which is our main goal. So, you know, it's understandable. We are still doing the Farmers Assistance Program at the fairgrounds on September 14th and September 28th. September 14th is kind of a normal one. September 28th, we are working with Ben Roethlisberger and Vance McDonald to do a Convoy of Hope distribution. So it'll be in conjunction with the CFAP program, but there will also be non-perishable items distributed as well. And that will be for up to 1,000 families. So it'll be a marathon, two days, the 14th and the 28th. There are no income guidelines for these two programs, so anyone who eats qualifies. It's a great program. It's labor intensive, but it's worth it. And then hopefully we will be doing 2 more in October, but that hasn't been decided yet on the national level through the USDA as to what programs are getting funded for that. So we do have 2 scheduled distributions in October, but we'll be putting that out in the newspaper, social media, and the radio. Other than that, again, we could use all the volunteers that anybody can send us. We just ask that they pre-sign up on our website. And thank you to everybody for your support. We really appreciate it.
Awesome. Thank you very much, Jennifer. I appreciate the update. Moving on to Sherry Anderson, who's here with Feeding the Spirit. I know Deb couldn't join us, but I'm glad that Sherry could be with us. Sherry, do you have an update for us?
Can you hear me?
Loud and clear.
All right, hallelujah! I finally got on. Yes, for just a couple of things to report for Feeding the Spirit. We continue our Saturday afternoon distribution at St. Clair Park from 2 to 3. In August, we served 1,173 individuals. That's a combination of walk-ins and drive-ins. We also dispense diapers and some other things that may come up. We are continuing the distribution at St. Clair Park through September, and then we will be heading back to Audubon Church beginning October 1 for the same kind of system. We did go down to look at the premises and determined that we could do the same kind of distribution with the back boxes, etc., which is good to hear. I want to commend again the restaurants. They have been phenomenal. We, through some grants, were very blessed to be able to pay them something for doing it. And I have to say that some of the other restaurants also still drop off some food for us to do that. And then again, we are so grateful for the partnership. It's gone really wonderfully, and we're really glad that we could reimburse them somewhat for all the work that they've done and what they've contributed. So that's the update for Feeding the Spirit, and we continue our usual Feeding the Spirit, helping people in crisis. Thank you.
Thank you, Sherry. I really appreciate you taking the time to join us. Good information. Dan Carney is here from Union Mission. Dan, love an update.
Appreciate the opportunity to share out. Kind of did a survey across the programs in our community that are working on housing and homelessness. All of our shelters in the county continue to be operating and working hard. We are noticing some barriers or emerging themes that are affecting normal shelter operation and delivery and longer term outcomes, things that you would probably expect at this time. Slower moving housing availability. The housing stock isn't turning over as frequently. Connection to employment for a source of income for folks. Households that are degrading because of the stress of the situation and the longer term impact that not being able to get housing has had. Of course, overall mental wellness with a particular focus on connecting folks to psychiatric services for medication. We're finding, telehealth and, technological challenges for some of our clients, access to technology, ability to use technology, or their needs just don't fit with that. Delays in getting identifying information, especially Social Security cards that are important for access to certain services, unemployment delays, and of course, as Dr. Conway mentioned, some of the education barriers that we're seeing with some of the households that we're serving. In addition to the shelter programs that continue to deliver, Blackburn is offering their normal programs, including advocacy, counseling, and therapy, school program. SPHS continues to deliver their services beyond shelter and housing programs as well. The Bridge to Home program, which operates regionally, is a program that connects youth age 16 to 20 who are experiencing instability to volunteer homes. Westmoreland County in that program continues to have the largest number of referrals in that program. In the past 6 weeks, they've had 12 referrals, 8 of which were from Westmoreland County. And the challenge is that the volunteer homes are full. So we continue to look for volunteer homes for that program to serve that population. The homeless eviction prevention programs that are operating in our county, you may be aware that the CDC put out a federal proclamation, a declaration determining that evictions of tenants could be detrimental to public health, and therefore extended the availability of the moratorium through December 31st, 2020. I will share out so that we can put on the website the declaration form that the tenants would have to sign. If you're working with a tenant, there are 7 kind of conditions that they have to attest that they meet in order to qualify. And we are seeing that, folks, legal representation from both tenants and landlords are calling to verify they're applying for the rent relief programs and things like that. That's one of the caveats, that they have to make sure they're doing everything within their effort to get that rent covered. If landlords are also getting a little bit more, for lack of a better word, intelligent about how they're going about evictions. So they can still evict for other lease violations that aren't rent-based, and they're finding those things and proceeding with evictions under those things. So we're trying to do some landlord remediation and helping if it's damages or other things that we can connect them to resources for to prevent that eviction. We want to do that. We have several programs in our county that provide assistance. The CARES PHFA rent relief program is available. We'll continue to take applications through September 30th. They are working with legislation to try to extend that deadline back to October and maybe further. But right now it's set for September 30th. But we're seeing about a 40% approval with that program. Those folks that have not had income pre-January of this year are the ones that normally aren't qualifying and haven't paid rent for the entirety of the year. The moratorium just kind of caught them where they would have typically been evicted, and so we're seeing landlords not want to accept the lower amounts and so forth. So that program still is probably your primary referral source. HAP, Homeless Assistance Program that the County Housing Authority has additional monies that they've received to provide assistance that can help for $1,000 for an individual or $1,500 for a family. And again, that's a great resource to have available. The Community Action Agency has CSBG funding available. They also have availability in some of their rental units and other housing and mental health programs. Catholic Charities, as I'm sure all are aware, has additional funds and are working really hard with utility assistance and some other things. We're really focused on right now this idea of keeping everybody as housing stable as possible and trying to have mechanisms in place as the moratorium shifts and as the CARES rent relief program shuts down, that we have other avenues to work with homeless prevention and to help stabilize households as we go into the new year, and contingency plans so that our shelters don't become overrun with the volume of people that could potentially be facing homelessness at the turn of the year. That's it for me.
It's a lot of good information, Dan. Dirk, just real quick, I'm wondering whether those resources that Dan mentioned around housing and the HAP program and the Catholic Charities options and all of the other resources, are those listed on the website, at the county's website?
I'm not sure they're all listed. Maybe it would be a good idea, Dan, if you wouldn't mind sending me an email with all those resources, and we'll use that as a checklist for the website.
You got it.
Thank you, Dan.
Great,
Great
that sounds
report.
great.
Thank you.
And for those that are listening, the website I'm referring to, the county's website that I'm referring to, you can find at the very bottom of the slides there, where you see the tinyurl.com/2020 response. So make sure that you check in there if you need to locate those resources that Dan was talking about once we get those checked. And the other point I want to make is that on the eviction moratorium, that's a great example of our sector mobilizing to make sure that our voices are heard. I know lots of you had reached out to our local officials and state and national officials to really make sure that that extension was made. And I want to say thank you to those folks that took extra time to advocate for that. Really important, again, to ensure that folks stay in their house. I want to go ahead and move on over at this point to Jordan Pleo, who's here with us from the Hill Group, who will talk a little bit about the human services study that's being pushed by, or that's being created by the United Way in partnership with the Community Foundation. Jordan?
Thanks, Phil. Good morning, everybody. A quick update from me. On our August monthly call, we introduced this. We had just kicked off this project earlier that week at the beginning of August. And we are now at the point where we are digging into a lot of secondary data. Just a quick reminder of what we're doing, though, for everyone on the call. This human services assessment is really about understanding the human services ecosystem throughout Westmoreland County, where things are happening, where things need to happen. That could mean identifying geographic areas that are underserved. It could mean identifying populations that are underserved, services that are under invested in, or several other outcomes that we expect to find. The point is to make recommendations to improve the entire ecosystem. And so by the end of our process, we will have a report that provides a number of recommendations on improving, enhancing, amplifying human services in Westmoreland County. In order to get there, we're doing a lot of secondary data analysis, and that's what I alluded to has been keeping us busy over the last month. So we've got lots of financial information on 120 plus human service organizations throughout the county that's publicly available. We've got 211 data that Jesse mentioned earlier. We've got data from Dirk and the county that we are looking over, and we'll be asking many of you for data as well. And after we get through some of this secondary analysis, we'll be doing a lot of primary data analysis and collection. So talking with many of you, talking with your colleagues, interviews, surveys. I mentioned in August that I know the last thing you need is another complex survey coming across your email. But we do think it's going to be really helpful to understand your impressions and perceptions of human services. How's the funding? How are the service levels? Where do you think unmet need might be? Do you have waiting lists? How long are they? All of those sorts of questions will be really important to this work and to the future of human services in the county. So that's where we are. Keep your eyes peeled for a survey or an email from me, Jordan Paletto, the Hill Group, because I may be asking you some questions about human services from your vantage point. That's all I have for this morning.
Great.
Thanks.
Thank you, Jordan. I appreciate it. One of the pieces of data that I'll be sending you, Jordan, is the data that we've collected in partnership with the Pittsburgh Foundation, the United Way, and the PANO, the Pennsylvania Association of Nonprofit Organizations, on the impact of COVID on revenue throughout the nonprofit sector, but particularly in the human services sector. So that data has been collected. We will have by Fourth Economy has been analyzing that data, and we will have firm data to share by the end of by tomorrow. So I'll make sure I share that with you, and I'll be sharing that with the whole group next month as well. So and that probably will also be good information to share with Jim Smith, who's up next to talk to us about some of the CARES Act funding through the county. Jim.
Good morning, everybody. Thank you for having me on again, Phil, and for your indulgence, everybody, with the process, which I know has taken a lot longer than everybody would have liked. We have just wrapped up all of the for-profit applications, which is the good news. We had 397 of those. So those are completed and sitting with the commissioners now. We're waiting their review and approval, and we're starting to dig into the nonprofits. What will happen for those of you on the call who have applied, we'll be going through each application, reviewing them, making sure they're complete. If they're not complete, we will be reaching out to you to give you an opportunity to correct whatever deficiencies may have existed within those apps. You'll have a 48-hour period of time to make those corrections. You know, if there's some extenuating circumstance, you can't do it within that, let us know. We'll certainly work with you. The idea here is to get the money out on the streets where it can do some good. Once we get through that process, and we've got 142 nonprofit applications, so we're anticipating that that's going to take us about 2 weeks to get through, starting basically yesterday, so 2 weeks from yesterday. Once we get through that, the commissioners will then begin making awards. What that time frame looks like on their end, I can't say. I'm kind of interested to find out how the for-profit funding goes and what the timing comes out to be on that. I know that in speaking with the treasurer's office, they're interested in only doing one round of checks for the for-profit groups, and I'm assuming that's going to be the same for the nonprofit groups as well. So they've got to get through it, give their approvals, potentially follow up with anybody that they may have questions of, get grant contracts into place, and then cut checks. So I assume that process is going to take a few weeks as well. All right, so getting everybody their grant contracts and getting that through everybody's legal counsel, I'm assuming they're going to give about a week to 10 days for that to happen. But those are just my assumptions. I haven't had those kind of process discussions with them to date. We will be, hopefully, with the nonprofit sector that's a whole lot more used to doing grant work. Hopefully, those applications are going to come in a lot more complete. They will hopefully not be subject to a lot of the going back and forth with for-profit clients that we had to do. So it may be shorter than 2 weeks, but right now we're going to give 2 weeks as an estimate to get through that work. If we contact you, get back in touch with us just as soon as you can. If you've got questions, reach out to us. All of our cell phone numbers are up on our website. We're available 24/7. Just give us a call, give me a call, and I'll be sure to try and either answer or get back to you as the case may be. Few of the things that we've been seeing that people have been having questions with. All of the documentation that's been asked for is required, even though some of it may not necessarily make the most sense for how they're evaluating it. It is necessary. So if we reach out to you, it is for that purpose, to try and get those applications to be complete. The goal from our end, as I said, is to make certain that those are complete, and then they get those over to the commissioners. So we'll work with you. We'll walk you through it. I know that there's some organizations out there that are much more sophisticated and have a lot more capabilities than others. Don't let that bother you. If we're calling you up and asking for things like projections, for example, which were a big one with the for-profit community, we can walk you through that and walk you through a method of doing it and get you sample documents, etc. So if you have questions, if you have concerns, reach out to us, give us a call. I'm happy to answer any questions that anybody on the call here may have today. But that is the latest update from EGC, Phil.
Hey, thanks so much, Jim. And just as an offer, if there are questions that nonprofits have, about documentation that Jim is asking for, and if there's a way that the Community Foundation can assist you in getting those documents done or understanding what they're asking for, whatever the case may be, we're certainly always available and here to help to make sure that you can have as complete application as possible to have access to those funds. So I want to put that out. I think that's all we have for today in terms of speakers, unless I'm missing someone.
I just wanted to add, can you hear me?
Yes, sure, go ahead.
Real quick, I wanted to make sure that when I mentioned that on October 1, we're going back to Audubon, we'll also be going back to Thursdays. The restaurants are all in agreement with doing that. So again, we're going back to Thursday evening. I believe we'll beginning around from 5 to 6 to distribute the food.
Got it. I appreciate the clarification. Thank you, Sherry. Before we close, Dirk, anything come to mind that you wanted to share?
No, nothing else, Phil. Thank you.
Great. Jesse, anything from your end?
Nope, we're all good here. Thanks, Phil.
All right, great. Well, thank you all for all of your work, and thank you for joining us again this morning. Really an informative time. Once again, if you need anything from Dirk or from United Way or from myself, feel free to reach out and we can help you so we can get through this together. Thanks so much, everyone. Talk to you soon.
Thanks.